Welcome to Crossover Health. I'm Danielle, your virtual tour guide here at our home office in sunny San Clemente, California. This is where Crossover started over 10 years ago, and today our mission is stronger than ever. We're doing the hard work of changing how healthcare is delivered, paid for, and experienced for everyone. In short, we're redesigning the whole health experience. In fact, at Crossover, design everything is one of our core values. We place our members at the center of everything we design to inspire and engage them in good health and working towards their best lives. I'm excited to walk you through our incredible member experience, where you'll see how we've removed the barriers to getting the exceptional health you deserve. With Crossover, you'll have easy access to quality care provided by the same team of connected providers, plus all the little details that add up to what we call our special sauce. Let us show you how we do it. Simply finding a primary care doctor or the right therapist can be frustrating, and you may not even get to see them for a couple weeks. Not anymore. We make it easy to get quality care that's comprehensive. At Crossover, you can connect with your care team online with messages or a video visit, or be seen in person at one of our health centers. Or you can get treatment using a combination of the two, whatever works best for you. Being a Crossover member means the care you need will be available when you need it and how you need it. More than getting access to care, what makes Crossover different from your typical doctor's office or telehealth provider is that instead of a single primary care provider giving you care, you have an entire interdisciplinary primary health team. Your Crossover team has a primary care doctor, a nurse, a mental health professional, a physical therapist, a health coach, and a care navigator. They're all in one simple place to give you coordinated care. And you get the same care team every time, which means you don't have to start over every time you get care. They already know you and your history. Having a care team of different providers is important because your health is impacted by many different factors and by your environment. An integrated care team from different disciplines enable us to get to know you and treat the whole you, and to treat the root cause of your health concerns rather than only treating your symptoms. Crossover attracts talented providers who are passionate about practicing and changing healthcare. We also build our care team to reflect the diversity of the communities we serve. You won't always need an entire care team for every health concern. You may only need a doctor or a psychologist or a physical therapist. No more having to research and find each type of provider on your own, or go to one appointment only to be referred to another one. Let's take a closer look at each member of your care team. Your primary care doctor is your care team leader. They are board certified and manage all the health concerns that a typical primary care physician would treat, like sick care, maybe you have strep throat, routine care, you need a yearly physical, immunizations, and helping to manage chronic illness like diabetes or hypertension. You have your own mental health expert. Crossover psychologists and licensed therapists who make up our mental health team are keeping very busy these days with mental health needs reaching epidemic levels in the United States. That's why it's important that Crossover members are able to get a face-to-face appointment with a licensed mental health provider in just 6 days. Compare that to waiting 48 days for a mental health appointment in the community. These compassionate professionals are able to treat a wide variety of mental health conditions and have diverse expertise across the team. Sessions are goal-focused and time-bound to promote resiliency, independence, and to build autonomy, and it can be delivered in individual or group settings. From anxiety to addiction, from sleep to suicidal thoughts, from burnout to behavioral disorders, this team is making a meaningful impact on many of our members' lives. In times of COVID, we've increasingly helped people cope with their loneliness, grief, and relationships. Next, we have your physical therapist. Pain is your body's way of telling you something is wrong. Yet there's not always a clear path on getting care for pain, or let's face it, it just takes too long. Many people wait or hope the pain will go away, and it only gets worse. That's why your care team includes a certified physical therapist to support your bone, joint, and tissue health. You can schedule directly with your Crossover PT without the need for a referral. The PTs are working with many of our Crossover members who work in warehouses or distribution centers and whose jobs depend on their physical strength and their mobility. They're also working with office workers, improving ergonomics, headaches, and stretching. And then there are our weekend warriors, the DIYers, and the marathon runners. The body is made to move, and this team will keep you moving, pain-free. Your PT can work closely with the fitness coaches on staff to treat musculoskeletal conditions, reduce pain, improve your strength and your mobility. I, for one, love to talk about the health coach on your team. You don't have to be sick to work with our care teams. Many of our members are motivated to live a healthy lifestyle and strive for complete well-being. And coaching is the perfect service for this. Crossover's health coaches are health experts like registered dietitians, but they have education and experience to help guide you to achieving your personal health goals. These goals might include weight loss, nutrition planning, quitting smoking, sleep health, and mindfulness. Our board-certified health coaches will help you set your goals, chart out a plan, try new strategies, check in for accountability, and cheer you on for as long as it takes. We partner with your doctor, and we also work very closely with Crossover certified fitness coaches. Those fitness coaches can help build tailored exercise plans, record your biometrics over time, and track your progress. They also lead online and live fitness classes. There's yoga, strength training, high-intensity interval training, there's cardio, and there's other classes to choose from. And they are free, so you can afford to mix it up from time to time. There is a dedicated referral specialist working hand in hand with every care team. We call them Care Navigators. They are ready to assist you in receiving the most appropriate, high quality, and affordable care in your health plan's network, and community resources and support. They'll coordinate the paperwork and the communication between community specialists and Crossover so that you don't have to. They'll help you make appointments and can help answer any questions you may have about the process, next steps, and cost. If you're getting Crossover through your employer, our Care Navigators will know of other benefits or resources made available to you by your employer, and they'll direct you to those should you need them. We know care coordination needs are very different. Our members have received care navigation support in many ways. They've asked, will my health benefits cover a sleep study? Can you help me find the right providers, appointments, and records for my cancer diagnosis? How can I find housing options in my community to keep a roof over my family's head? Can you send my labs to my dermatologist? This, again, is how Crossover strives to make your entire healthcare experience as seamless and as easy as possible. We want to be your partner for your entire health journey because we believe that not sick is not good enough. We're building a community called Be Well for our members who want to invest in living their best lives. It started with self-care modules, podcasts, videos, and articles written and curated by our very own Crossover providers. You can shop for your next healthy activity or take a deep dive into topics that interest you. You'll learn a lot from trusted Be Well sources. We will continue to grow the Be Well community through member events, interactive talks, and interest groups. Think reading, hiking, baking, volunteering, maybe even trivia nights. We hope Be Well will become a source of inspiration and community for you. The crossover magic really comes alive when our care team collaborates together to help you with complex issues, chronic disease, or overall health goals. I've invited someone to join us on our tour today that knows a little, okay, a lot, about Crossover's care model and how it's all connected. Dr. Stephen Ezegiakoy is Crossover's Chief Medical Officer. Stephen, sometimes we call our model surround sound because we surround our members with care. I've heard you share a great example of how it all comes together.
I'm always happy to share how we do things at Crossover and how we're seeing the results for our members. I think this example really shows how different and personalized our care model is. Jack is a Crossover member who mentioned to his provider that his lower back had been hurting lately. The provider examines Jack to make sure there are no serious issues causing the pain. The care team schedules Jack with a physical therapist at a time of Jack's choosing. The provider notices that Jack has gained weight over the past year, and this may be contributing to his back pain. The provider connects Jack to the health coach on the care team. The physical therapist sets him up with a home exercise plan and shows him the low back health resources on Be Well. The physical therapist notices that Jack is scheduled to see a health coach to help him lose weight. The physical therapist offers to help Jack set up an exercise program to assist him with his weight loss that will not aggravate his back pain. They then schedule Jack's follow-up visit. In the care team huddle, the health coach also reports to the provider that Jack may be depressed, as Jack mentioned losing a family member recently. The provider has Jack do a mental health screening for depression and anxiety to determine if his grief could be contributing to his overall health issues. The end result is instead of Jack having to find and visit multiple providers who would each diagnose Jack with a single issue or condition, Jack received integrated, coordinated care that improved not just his physical health, but also his mental health. Jack is a motivated patient who hit all of his targets over the course of a few months with his care team supporting him. This is how your Crossover care team will work for you too, for as little or as long as it takes. You'll avoid going through unnecessary appointments and follow-ups, the stress of tracking and sending medical reports, the headaches of calling around for test results and sorting out confusing bills from multiple medical offices, not to mention the time and money you'll be saving from unnecessary care and visits. That's why we call our care model primary health.
We've talked about how easy it is to get care when and how you need it, how you have multiple foundational care services all together under one roof. All care at Crossover begins with the platform, which is our member technology. You can log in from anywhere, whenever and wherever you need your care team's help, thoughts, or guidance. You will have immediate access through the platform. From there, you can choose what service you want, what member of your care team to message, or when to schedule a video or in-person appointment. Here's a peek at how the platform works. Online care is one way to get care. For any health concerns, you can conveniently send us a secure message on your phone or computer to start a conversation. This back and forth communication is like texting you use in your everyday life, and it happens on your time, which is great, especially if you have a busy schedule, or you work different shifts, or just life in general. You may also make virtual video appointments with your care team should you need them, or prefer to speak face-to-face with your provider. Think about when you feel sick and you wonder if you even need to see a provider. At Crossover, you don't have to worry. You can start working with your care team right away, even if it's after hours or on the weekend. It's great for getting treatment started faster and easy to get your follow-up questions answered or test results without having to wait for an appointment. It's also where you'll be able to log in and go exploring and be well. Crossover's platform also gives you access to in-person care in our clean, modern health centers. Members could visit us at an on-campus health center, and others could visit us at one of our near sites, which are shared health centers near employee homes. When you arrive for your appointment, you'll be greeted by a friendly crossover host who will promptly check you in, and if you haven't done so, on your phone or computer. Your time's valuable, which is why we'll have you in an exam or treatment room within 5 minutes of your appointment time. Also, we're a paperless company, so you won't see paper clipboards, a file room, or signs posted in our facilities. All of our care rooms are beautifully designed with your comfort in mind and with state-of-the-art medical equipment and technology for our staff to serve you better. A few of the features you'll see in an exam room are the entrance. So the entrance to the exam room is separate from the physician entrance for maximum privacy. Our health center visitors will not see you in your room or see which provider you are seeing. You also have a cabinet for your clothing, your bags, and a charger for your phone. We've provided the member and provider a table and chairs to face one another while having a meaningful conversation about your overall health. Why? Because sitting on an exam chair in a paper robe is not how most of us feel comfortable. Speaking of clothing, our providers do not wear white lab coats. This also seems to put our members at ease. Most people don't enjoy stepping on a scale either, so our exam chairs track your weight. Our physical therapy treatment rooms have been outfitted with the best equipment for helping you get the most out of your sessions. We have physical therapy chairs, treadmills, yoga, stretching mats, as well as a weight set to get you feeling stronger again. Let me tell you a little bit about our mental health and coaching rooms. So just like our exam rooms, they're very private, but they're furnished comfortably. They're also usually offset from the entrance, so no one will be able to see which room you're going into. And we do this so that you feel you're most comfortable sharing your mental health concerns or your lifestyle goals. It's the small details that help make the crossover experience exceptional. Crossover can also complete routine lab work in our center while you are still in your appointment, as well as dispense medication, depending on what state you're in. No need to go to a lab or a pharmacy in most cases. And we don't overbook our calendars. The time you book is yours, which means you're free to use your full appointment time without feeling rushed out the door. That's how we get to know you better. So what if you don't live or work near a crossover health center? No worries. When there isn't a health center near you, a care navigator will make you an in-network appointment in your community whenever that is required. Again, the important thing is giving access to quality care when you need it and avoiding those unnecessary visits to the ER or urgent care. But before we move on, did you notice some of the colorful designs and unique art on the walls? Every room in every center is custom created by Crossover. The themes, the art are all original and reflect the diversity, heritage, and culture of the communities we serve. We've shown you how Crossover has deconstructed the complex healthcare system so that we could rebuild it simpler, convenient, connected. But what it boils down to for us every day is what our members think about Crossover. Their surprise and delight when they walk into a center for the first time. Or a message with a friendly provider who wants to truly help them in all aspects of their life. The hugs, the written words that are given to our staff. The tears when we speak their language. The relief when they learn that they have found a medical home to access anytime and for any reason. And a guide to walk them through the steps to take out the confusion and the hard work. The milestones that we share with them, some they didn't even believe they could ever achieve. Here, they feel they belong. That's our special sauce, and that's what really matters.